Today we will address intravenous therapy, also known as IV therapy. This is a fairly common skill to perform when our corpsmen head out into the field environment with the Marines and Seabees. In this video, we'll lay out the steps you will need to hit for a successful practical phase of training. Because you will be performing medical care, remember to utilize universal precautions and use all the proper PPE. Another safety guideline that will help maintain a safe environment includes addressing any blood spilled by following the current command policy. When starting IVs, the corpsman will never double stick the patient, so just remember one stick per IV catheter. And before the IV tubing is attached for use, the tubing will have all air flushed and it will contain only the IV solution. Just as we did in the venipuncture training, we will not recap needles as we will simply dispose of them in a nearby sharps container. The equipment required for initiating IV therapy is an administration set, IV solution or bag, tourniquet, IV catheter, tape, transparent dressing, a marker or pin, 2x2 gauze, alcohol swabs, non-sterile gloves, Chuck's pad, IV pole, and the proper form or forms such as the DD792 and, of course, everybody's favorite, the venerable SF600. To begin, you verify the provider's orders and calculate the proper drip rate. There are two basic IV tubing sets, the macro drip and the micro drip. The macro drip is usually used for infusing larger volumes of IV fluid, so you will see these utilized for burn patients or in cases of dehydration where aggressive fluid replacement will occur. The macro drip set is also the mainstay in trauma care, so the FMF types out there should be accustomed to these drip sets. There will be a number associated with these tubing sets, and the macro is usually labeled as a 10 drip set. All this means is that it takes 10 drops to equal 1 cc or 1 ml. The other type of drip set is known as the micro drip set, and it usually is associated with the number 60. This means it takes 60 drops to equal 1 cc or 1 ml. Because it takes many more drops to equal a milliliter, this means that you can fine-tune the amount flowing into the patient much easier than with a macro drip set. These micro drip sets are usually used to administer medications by mixing the medication into the IV bag or as a way to keep the vein open from clotting and preventing further use of the IV as a means of medication or fluid administration. Once you have confirmed the drip rate, you need to verify you will be treating the correct patient by utilizing the two identifier method, which includes matching the identification bracelet to the provider's orders and then confirming the patient's identity by asking the patient his or her name. Explain the procedure to the patient so they know what to expect, and then gather all the required equipment and ensure that you can easily access it once you start the IV procedure. IV fluid is considered a medication, so you use the 6 patient rights in an attempt to reduce errors. Those rights are the right medication, or in this case, the proper IV fluid, the right dose, the right time, the right route, the right patient, and the right documentation. Now grab the IV bag and tubing, check the bag for leaks, look for cloudiness or particles that might be floating in the solution, and make sure the IV solution itself is not expired. Once the IV bag is determined to be okay for use, insert the spike end of the tubing into the rubber stopper on the IV bag. Squeeze the drip chamber and fill the IV fluid to around 1/3 to 1/2 full. Remove the cap at the end of the tubing and slowly open the roller clamp to allow fluid through the tubing. By doing this, you will force the air out of the end of the tubing, and when you finish, the tubing will be totally clear of all air bubbles. Now label the IV bag and tubing with what type of solution is contained in the bag, the date and the time the IV was established, and the corpsman's initials. The IV and tubing are ready to go, so now you tear off 3 or 4 pieces of tape and have them ready to tape the tubing to the patient. Now go wash your mitts and don non-sterile gloves, and then make sure you have on all required PPE. Have the patient extend their arms so it forms a straight line from their shoulder to the wrist. While they're doing this, put a Chuck's pad under their arm. Apply the tourniquet about 4 to 6 inches above the anticipated IV site. Once the tourniquet is in place, look at the extremity distal to the tourniquet and pick the best site by having the patient make a fist and see what vein pops up the best. Once you've made your choice, release the tourniquet. Gather all the equipment and reapply the tourniquet. Now clean the area with an alcohol swab, starting at the IV site and work outward in a circular motion for around 2 inches and then let it dry. Open the IV catheter and inspect the tip. You are looking to ensure that it has a bevel, the needle has a bevel, and that the catheter is around the needle and not over the sharp end where it can shear and create a foreign body embolus. Now place your thumb and forefinger about 1.5 inches below or distal to the IV site and pull tension. This will anchor the vein and increase your chances of success. Now grab the catheter with the bevel facing up and insert it into the skin and vein at a 10 to 30 degree angle. When you enter the vein, you might feel a pop. That is not always the case. What you should always see is blood return into the flashback chamber located on the rear of the catheter. When you see the flashback of blood, lower the needle and the catheter to the point where they are almost parallel to the skin and advance them about 1/4 of an inch further into the vein. Once that is done, slide the catheter into the vein while holding the needle in place. The catheter sits on the outside of the needle and it will slide when you apply gentle pressure. The needle should always remain immobile. Now, release the tourniquet while you pull the needle out. You will put pressure on with one hand just above or proximal to the IV site to stop or lessen bleeding. There will be a sharps container handy, and now would be a great time to put the needle in the container. Remove the cap at the end of the tubing and connect it to the IV catheter. Once that is completed, slowly open the roller clamp on the IV tubing and make sure there is no swelling or leaking around the IV site. This ensures the IV is patent. Another trick to use once the IV is secured is to lower the IV bag beneath the IV site and see if blood flows backwards into the tubing. If it does, then the catheter is in place and the IV is patent. All you have to do then is just lift the IV bag and the blood will flow right back into the patient where it belongs. Now that the patency has been confirmed, anchor the catheter in place using a transparent dressing. Once that's done, loop the IV tubing near the IV site and tape it into place using your pre-torn strips. Now make sure that the IV tubing is labeled using the date, time of insertion, the catheter gauge size, and the corpsman's initials. Doff your glove, wash your hands, and document the procedure before you forget what you've done. So congratulations, we've got the IV started, and we hope it helped the patient heal. But at some point, the IV is going to need to be discontinued or taken out. The next section explains the steps necessary to discontinue or remove the IV from the patient. First things first, make sure that the patient needs the IV pulled by confirming the provider's orders and making sure it is the correct patient by checking using the same two patient identification method that we used before. Explain the procedure to the patient and gather all the necessary equipment, which basically consists of just 2x2 gauze, tape, a sharps container, and possibly a Band-Aid. Once a patient understands the procedure, clean your hands and don non-sterile gloves. An important tip to remember is to close the roller clamp at this point. But if you don't remember, no big deal. You will once you notice a puddle forming around the patient. Remove the dressing over the IV site and also use tape to secure the IV and also the tape that was used to secure the IV tubing. So everything's going to be removed. While you're doing this, look at the IV site and the surrounding area and check for signs of phlebitis, such as redness, increased warmth to the touch, or maybe a little tenderness. Also look for signs that the IV might have infiltrated or leaked into the surrounding tissue. In this instance, you'll notice swelling or puffiness in the area around the IV site. Now place a sterile 2x2 gauze above the IV site and remove the catheter by withdrawing it in a slow and steady motion. Once the catheter is out of the patient, immediately move the gauze to the site and apply pressure. While you're applying pressure and waiting for the bleeding to stop, take the time to inspect the catheter. You should pay particular attention to the tip of the catheter and make sure that it's intact. If it is, then go ahead and discard into the nearby sharps container. By now, the bleeding should be slowing or stopped, so use a clean 2x2 to replace the first gauze and then tape that clean 2x2 into place. You could also use a Band-Aid here, but if you use the gauze and apply pressure with the tape, it usually bruises a little bit less, so that's usually preferred by the patient. Now that the patient has stopped bleeding, the IV site is covered, and all the contaminated equipment has been properly disposed of, doff your gloves, wash your hands, and document the procedure on the proper form. So congratulations on getting through this training and managing to stay awake the entire time. This was a long one. So we have prepared a little Jeopardy game to help you remember some of the key points of this training. Good luck on the practical portion of the training and have a fine Navy day.